It is 7:42. Welcome back to the WKYC app. February is National Children's Dental Health Month, and a great reminder, teach your kids how to take care of their teeth properly. But really, it starts with you and the kind of example you are giving. Senior health correspondent Monica Robbins joins us now in Studio B with tips on how to make it easier and what you need to know. Very important here, Monica.
Yeah, we all need to listen to this because it's one of the most important lessons parents teach their kids, how to properly brush their teeth. But are we doing it right? And is there anything different these days that we need to know about? So joining me now is Dr. Brian Martin, a pediatric dentist with Akron Children's. Thank you so much for being here.
Monica, it's my pleasure.
Everybody's like, I know how to brush my teeth. But how many times are we actually supposed to do it in a day?
So we should be brushing our teeth a minimum of 2 times a day, right? The reality is that our American diet, the sodas, the juices, a lot of the things that we do to our teeth, the Sour Patch Kids candy or sour candies, really challenge our oral health. So we say minimum 2 times a day, right? For 2 minutes, minimum.
So what is the 2-2-2 rule? I'm hearing the 2 and the 2. So what's the other 2?
Yeah, so we should do twice a day, right, for a minimum of two times, and we should see our dentist at least twice a year.
Well, that makes a lot of sense. So what are we teaching our kids, though? Because parents are often, go brush your teeth, Junior.
Of course.
And not necessarily teaching them how.
Yeah, so the basics of toothbrushing, it's pretty straightforward. There's something called the modified, if we want to get ultra nerdy about it, there's something called the modified Bass technique, which basically somebody invented way back in the day about using really small circles whenever we get in there and brush our teeth. Advantage of modern technology is we have power toothbrushes now. One of the things I recommend for really all of my patients, if they can tolerate them, are these motorized toothbrushes, because they get in there and do that action, and they do it a little more effectively than a kid or even sometimes adults can. So we want to make sure that we're getting in, we want to cover all the teeth, make sure you get upper, bottom, sides, inside the lower jaw, and upper back, top back, are common areas for people to miss. And that's part of that 2-minute rule, right? If sometimes, particularly with younger kids, you say, go brush your teeth, it might last a few seconds. They get in there 1, 2, but we want to make sure we take our time to get that brush all over the mouth.
Here's a full disclosure, I'm not perfect at this, but how do you teach your kid how to floss?
So flossing is similar. We want to make sure if the teeth are touching, that's an opportunity to floss, all right? Little bit of family lore, but my wife's family my wife comes from a dental family, and her father used to tell her, if you don't floss your teeth, it's like not washing the sides of your body, which is kind of gross if you think about it, but pretty effective and motivating me at least to floss my teeth. So you should basically, any tooth that when you put that floss in there and you get a little bit of a catch or you get a little bit of an area where that touches, that's a great opportunity to floss.
Are water picks just as good?
Water picks have their place, but are they just as good as removing plaque effectively mechanically with floss? A little bit up for debate. There's some questions about that. I'm an advocate of saying, hey, we want to get in there and perform oral hygiene, right? So if a water pick is what you can tolerate, that's better than doing nothing. I can tell you personally, though, I'm an old school fan of floss.
So what's giving kids cavities these days? Is it the candy? Is it something else?
Great question. So, it's a mix of all of the different types of carbohydrates we have in our diet. So candy, of course, classic sugar, right? You think about that. But it's also things that we drink, all right? We drink a lot of sugar. We have a lot of sugar and a lot of acidity in the things that we drink today. So, and the other thing is combined with the fact that fewer and fewer kids are going to the tap, as I like to say, for hydration. They go to the fridge and get a can of something or a pouch of something or something like that. Our bodies are really meant to run on water. This is the narrative that I have with every single patient and family that I see. Things that aren't water have that carbohydrate, have that acid, both of which contribute to feeding the bacteria that cause decay.
So you mentioned water. Fluoride in the water is a hot topic. What do
Sure.
parents need to know?
Sure. So fluoride is safe and effective in recommended doses. It's been part of the water supply for many, many years, upwards of 60 years here in this country. Most importantly, though, the most current science with fluoride is actually that most of its action is topical. It's the fluoride that's actually touching the teeth, which is what's important. And that comes back to that, why do we brush our teeth twice a day? Teeth do best whenever we have multiple small amounts of fluoride applied to them. That allows the tooth to do what we call remineralize, or when acid challenges your tooth, it sort of erodes or removes a little bit of it. The fluoride in the toothpaste comes in and kind of rebuilds. You can picture almost like patching a pothole on a road. It strengthens that area chemically with the fluoride in the toothpaste. In order for that to be effective, you can't just do it once in a blue moon. You need to do it small applications repeatedly over time. It's sort of a daily discipline, which is what brings about the best protection.
Great advice, Dr. Martin. Thank you so much for being with us.
Thank you, Monica. Always a pleasure.
Back to you, Dave.
All right, Monica, boy, I tell you, I wish I would have had more of this information when I was a kid. We have been very strict with our kids after learning what I should have done better as a kid. So this is really good information.
I was no angel either.
Yeah.
So, yeah.
If we could only go back with us, we could pass it on to our kids. All right.
Absolutely.
Great interview, Monica. Thank you.